I'm Steven Bagshaw, Head of Business Strategy here at CPI for our health tech activities, and today we're going to be talking about 5G in healthcare in brief. Okay, so 5G stands for fifth generation technology, so it's the fifth generation of evolution of mobile wireless communication technology. And if you think about 1G, so in the 1980s when you had analog phones we could do basic calls, 2G phones became a little bit more advanced, so you were able to send text messages or even multimedia messages. 3G phones started to become a bit more digitally advanced, so we're starting to get the emergence of smartphones and starting to have phones which could connect to the internet, but effectively 3G was replacing modems and the like with wireless communication technologies, and 4G is the phones that we know of today. So there's connectivity to the internet, connectivity to YouTube, and the emergence of 5G is 10 times faster than 4G. So in the future, as we see the growth of the Internet of Things and the digitization of devices across many different industries, that's where we'll start to see the benefits of 5G technology. So some of the benefits of 5G over 4G around speed, so 5G is significantly faster, latency is another key differentiator, and also security as well. So 5G is believed to be more secure than 4G, which will help particularly in the healthcare industry when we're dealing with important data such as patient records, personal data, family data, etc. 5G in terms of healthcare is growing in traction. More and more devices are becoming digitally enabled in healthcare. If you think of the banking industry and the emergence of online banking, people used to term it as online banking or m-banking. Now it's just simply known as banking. So it's what's called shift-left technology. More simpler tasks where you don't need human interaction and moving online or becoming digitized, and that's happening also in healthcare, and 5G is enabling that. So if you think of the concept of hospitals without walls, so more and more healthcare is moving away from the physical hospital building, as we saw in the COVID pandemic, for instance, where people are doing remote monitoring. So we're seeing a big shift away from providing healthcare within the hospital, and the healthcare is becoming more decentralized, and 5G will act as enabling technology to allow more and more devices to connect and engage with each other. Some of the applications we could be enhancing the communications and the technology within ambulances, for instance, which is absolutely vital in those early stages as opposed to providing real specialist care within a hospital. You could have tracking of assets around hospitals or allocating where patients are potentially. And then there's more further out use cases, things like robotic surgery or remote surgery, where you really do need strong internet connections and you need communication with a lack of latency. What we're trying to do is create the environment to reduce those barriers to innovation for innovators who are looking to utilize digital health or 5G technologies. The healthcare industry, for a number of reasons, and rightly so, can sometimes be risk averse because we're dealing with really important things and ultimately people's lives and health, which is so important. What CPI is doing is creating the environment for organisations to engage in a test bed which is outside of the hospital environment, but the technologies and the techniques that we will use are translatable to a health and care setting. So what that does, it reduces the barriers to innovation. It allows innovators to try things and to see if they work, test and improve on them, which then will hopefully allow them to be adopted in a health and care setting. There's a huge challenge, as we're fully aware of in the NHS at this moment, around patient flow and discharge and the movement of people and patients through hospitals. And ultimately what we're trying to do is create technologies and create wellness type applications which will reduce the number of people needing acute hospital care, but there's real blockages within different areas of that kind of patient flow and discharge process. So CPI is working alongside a number of partners to look at innovative solutions in the care home aspect of the patient flow and discharge challenge. CPI is a technology innovation centre which effectively helps organisations to solve deep tech challenges in certain particular areas. So one of which we do that is in healthcare. So there's been many public concerns around 5G through the impact it has on the environment, the impact it has on human health. So the concerns around health with 5G generally lies around where 5G fits on the electromagnetic spectrum. So at lower frequencies and lower wavelengths, you've got things like radios and microwaves, and at higher frequencies you've got things like X-rays and gamma rays, which are used in cancer abolishment, for instance, which at the extreme end of the spectrum can be really dangerous. However, 5G is nowhere near that. It's more at the lower end of the frequency scale. And needs to be 1,000 times more higher in frequency to penetrate the human body. Thanks everyone, thanks for listening to 5G in healthcare in brief, and if you'd like to know or like to challenge any other topics, please let us know in the comments below.